Next, what's the next quick fire question we want to talk about?
Do you ever use metronomes in other activities apart from IM?
Yeah, so for kids with, particularly kids with challenges with inhibition, impulsive kids, and sequencing, there's a lot of good things you can do with just a metronome. So I've got a metronome app on my phone. You know, I will do things like jump, 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 jump down the hallway to rescue. And then we might try jump, stop, jump, stop, jump, stop, and like sort of be jumping from lily pads or like those rubber squares. And that's often hard enough for a lot of our kids, is just to not jump, 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 but to jump and then stop. You want to make it really hard. We have lots of kids that would be almost impossible for them to go jump, jump, stop, jump, jump, stop. Once they've done 2, then having to kick in that inhibition to stop is a real challenge for a lot of our kids. Or you could do jump, stop, stop, jump, jump, stop, stop. Yeah, so you can play around with some of those things. Are really great inhibition games, and you can play around with sequencing with it too. So you could use metronomes for things around just beats around organization and getting the timing and sequencing of a motor task. So getting that precision around bilaterality and stuff like that. So maybe punching on the metronome. You can also use music for that kind of piece as well. You know, and that's the same if you're doing punch, punch, punch. Kids are punching like this. If you can get crossing, that's great. Maybe with the focus mitts. But can you do left, left, right, left, left, right? Things like that. Can be working on multiple things. Sort of only want to work on one thing at once with our kids though too. So sometimes I'm looking at kids doing these kind of balance beam obstacle courses and I'm like, it's too hard. You can't be challenging 2 things at the same time as a general rule. So you don't want to challenge praxis and posture at the same time. If you're going to make them plan their actions, make it so that you're not stretching their strength and endurance by doing that plan. If you're going to be working their core, you're going to keep it a little simple so they're not having to think about the plan. It's the same. You can do some really cool stuff with just catching and throwing with the kid, where you're on a balance beam, where you're on a bosu, and that's great to do with the metronome as well. Catch, throw, behind my back, to the front, throw. Yeah, so rhythm and timing are everything. I'm going to go as far as saying that in many ways, dysregulation is synonymous with dysrhythmia. So kids that don't have good rhythm, you know, so they don't have good biological rhythms, sleep, wake, hunger, thirst, that have funny breath rates. So we see these kids that are short and shallow. We see these kids that hold their breath and then short and shallow, but it's like they don't have a beat to dance to, and it's sort of, they're just all over the shop. That if we can give them any rhythm, it's better. So even a fast rhythm is better than no rhythm for organizing and connecting with a kid. And so there's a lot of things we talk about that have timing elements to the words, right? So we talk about getting in sync. We talk about getting attuned, tuning in, right? All of these things have these bits of just sort of getting on the same wavelength. And so there's these commonalities across these social connection words and frameworks we use, as well as the sensory-based regulation, praxis, timing, and sequencing piece. And action regulation, we've talked about a couple of times, is really a disorder of not being organized, has a lot to do with getting into that rhythm, and that's a good way to tap into those guys as well. Okay.